My name is Dylan Lewis and my student number is 327-63173. For assignment 2, Part B for EDN449, I have chosen to write about autism spectrum disorder, or ASD. I chose this diagnosis because I have seen how common it is in all classrooms to have one or more children diagnosed with ASD, and believe that a better understanding of ASD will benefit students greatly. Autism spectrum disorder is a term that is used to cover a range of conditions which are characterized by challenges with social skills, repetitive behaviors, sensory sensitivities, and speech and nonverbal communication issues. These behaviors and difficulties can affect students' ability to learn and engage in a classroom environment. Although the behaviors of people diagnosed with ASD are similar, no two people with a diagnosis are the same. Each individual diagnosed with ASD has their own personality, their own traits, their own interests, and their own needs. This creates a difficult situation for all teaching staff who are required to teach students with ASD, as a teacher needs to learn the student's personality and traits almost instantly to minimize any discomfort and ensure that the child is learning to the best of their potential. Children usually begin to show signs of ASD around the age of 2 or to 3, usually for difficulty in showing social communication and interaction paired with repetitive behaviours, interests, or activities. Students diagnosed with ASD can find a range of factors in a classroom environment that deter them from their learning, including creating and maintaining relationships with people, maintaining focus on the lesson, becoming fixated on specific tasks or objects, or finding some topics extremely difficult. Although students diagnosed with ASD can find some topics very difficult to understand and learn, they can excel in some subjects, the most common example being mathematics. Some very simple strategies to assist students diagnosed with ASD in the classroom are to use visual aids. One example of using visual aids is to create a visual timetable which shows a daily routine, allowing the students opportunity to visualise what they will be participating in for the day, and prepare them for any change in classroom or teachers which may cause them discomfort. To continue with using visual aids, teachers can also create visual cues to remind students of the expected behaviours within the classroom, such as sitting on the mat, listening to the teacher while talking, and any other common reminders used. These visual reminders are useful as a student can see what the required behaviour is, while the teacher can continue teaching without having to pause to remind the students what they should be doing. These visual reminders can be paired with written text to maximise the effectiveness of the reminder, allowing a clear message for the students to follow. Another useful practice that will assist a student with ASD in the classroom is to use social stories to help the students deal with certain circumstances they find difficult. For example, students with ASD typically struggle to cope with change in the classroom. So to assist the student in understanding the change, a social story can be written up to explain the need for the change. These social stories will be required to include enough detail that the student understands that change is okay and temporary, and once completed, it will return to normal. Another practice I found that works well is to create a peer buddy system that allows other students in the classroom to assist the student diagnosed with ASD to improve their social skills through practice, and also allows other students to gain an understanding that although with ASD the student may act differently, they are just another student with their own personality. Although I have researched these practices, I've also seen them in use in both mainstream and education support classrooms to great success. They have assisted students diagnosed with ASD to cope with change and stress in a much more positive manner to the benefits of students, the teachers, and the classroom as a whole. These practices are also simple enough that any teacher can implement them within the classroom with very little training or research involved in preparing them. They can also be implemented for a range of students with other diagnoses and students with behavioural issues. Thanks for listening.